Sunak has revealed his long-awaited plans for the NHS today, aimed at solving the NHS's severe staffing crisis.
Now, Labour have said the plans for coming are too late, saying it's a carbon copy of the plans Sir Keir Starmer laid out in May. Well, joining us now is Health Secretary Steve Barkley. We had Shadow Health Secretary Wes Streeting on our programme earlier. He says, fine for you to nick Labour's plans as long as they work. So when will we, and those who experience NHS England, when will we feel the benefit of these plans?
Well, it's a hugely important day for the NHS. It's the biggest ever expansion in workforce training. It's got £2.4 billion of extra funding over the next 5 years. I mean, just to pick up Wes's point, I mean, the idea that it's their plan is laughable. Their plan doesn't touch on any other reform. And one of the key things we're setting out today is how we deliver workforce training in different ways, offer many more apprenticeships, which I think for many people watching this, they want the offer of apprenticeships. They want to be able to develop their career within the NHS. So we're opening up new roles. It's twice the number, 50,000 additional roles a year compared to the 23,000 that he set out. But what's really exciting today for the NHS is for many years the NHS themselves has said we want the framework of a long-term plan. And as we mark the 75th anniversary of the NHS, we've got this £2.4 billion, massive expansion in the numbers of doctors and nurses and midwives and other roles within the NHS. And that's what we're announcing. It's a plan that NHS England have written. We've worked with leaders across the NHS to develop this, and it's got an important element around increasing training numbers, how we better retain the staff we've got, but also how we reform and deliver services in new ways.
I think it's good that you mentioned that retention of staff, because I think that's the thing that we've heard mostly from lots of our viewers this morning when they've heard about the plans, that as positive as it sounds to be recruiting all these people, how are you going to be recruiting people when you can't retain the staff that you have at the moment? So just talk us through what the plans are to try and improve the scenario for our nurses, for our GPs, for our junior doctors, in terms of keeping them in the NHS, because we are losing too many of them, aren't we?
Well, you're absolutely right. It's important to retain our staff. It's better to keep staff that we've already trained than to have the delay and time of training more. And we need to do both. And in terms of retention, we've already made significant changes, for example, to pension tax rules, which was the key ask of many doctors that we've done. We've already done that. I think the announcement of the plan and the boost in numbers that this sets out will send a hugely positive signal to many in the NHS. Certainly the conversations I've been having with NHS leaders, they say that it will be a really positive message to people within the NHS. But also in terms of retaining staff, we need to have more flexibility in the roles that we offer. Often people have changing needs in terms of childcare responsibilities, for example, at an early stage or for an elderly relative. So we need to make sure that roles are more flexible, and we need to have new roles that allow people to grow their career. Things like physician associates, which is a role we've already got, but we need to expand much more. So it's about having more flexibility in the roles that are offered, in the way that people can work, in the professional development that the plan commits to as well. And that's a key part of how we better retain our staff.
So you've got a sort of buffet of options there, but you haven't mentioned money. And that's the thing that's brought the NHS into a situation where we're seeing strikes in areas we've never seen strikes before. In a letter to you on Tuesday, I think, if I've got my dates right, the BMA Consultants Committee Chair wanted to meet you and talk to you. Have you responded to that yet?
Well, on money, and you're right, that's an important issue. We've agreed that with the biggest group within the NHS, the 1.3 million staff in the Agenda for Change, we've reached an agreement with them. That goes into pay packets this month, the 5% plus a lump sum on top, and that covers nurses, midwives, paramedics, porters, cleaners within the NHS. So the biggest staff group, the government has reached an agreement with, and we're working closely with trade union colleagues in terms of some of the details of that deal. And to the point on retention, that includes things like extending pension abatement rules as part of that, which was one of the things
that we're asked
for. Let's talk about doctors then
as well. Fantastic that you've managed to sort that out, because that took a long time coming. But the BMA have said investing in medical school places while refusing to reverse years of pay erosion for doctors is completely illogical and uneconomical.
Well, we need to increase the number of doctors that we train. That's something that many within the NHS call for, and that's what the plan commits to. In terms of the discussion with the BMA, it isn't reasonable at a time of high inflation for the junior doctors to demand a 35% pay rise. There's got to be movement on both sides. We stand ready to engage. Well, we're not going to negotiate on public, but there needs to be movement on both sides. And to date, the junior doctors have refused to move from their demand for a 35% pay rise. But we hugely value the work of NHS staff, and that's why we're making this £2.4 billion commitment, a long-term plan, the first time ever within the NHS's history, doubling the number of doctors that we train, but also offering new ways for people to become doctors. So for the first time, we'll have doctor apprenticeships where people can do an apprenticeship, still to the same standards, still the same exams, still the GMC's regulation, but you can become a doctor by doing an apprenticeship as opposed to going to university. And it's about making sure we're flexible in terms of people want to learn in different ways. How do we recruit to those parts of the country that often find it harder to attract doctors? So having more vocational training and more apprenticeships, including that into the route of doctor, but also expanding the roles that people can do within the NHS so that they can grow their career. And if we can grow their career, that is one of the key ways we help retain staff as well.
There's many people that have commented that this looks very positive. They want to see the detail and how it plays out. So how do we know that you can deliver on this? In 2019, somebody in your job, Sajid Javid, promised to deliver 6,000 more GPs. Then that had to be abandoned. The targets of trying to recover post-COVID have been seriously missed. That was eliminating waiting lists of more than 78 weeks. How do we know that this is actually going to be delivered, particularly as it's only funded for 5 years?
Well, there's much that is being delivered already. So we had a 25% expansion in doctor places in 2018, and they will come through into the wards from next summer. We opened 5 new medical schools. We made a commitment in the manifesto to 50,000 more nurses. We've got 44,000. We're on track to deliver that. We also made a commitment in our manifesto to increase the number of roles within primary care in our GP surgeries. And we've got 29,000
fewer GPs, haven't we? We've got 2,000 fewer GPs than 2015.
We've got 75,000 staff on sick leave with mental stress. We could all play figures.
The NHS staff don't feel valued. They feel under concern. They are leaving, and we've already seen people talking about it. They're leaving for countries where the pay is better, the conditions are better, and they're being looked after better. That's the reality.
And one of the key things people have said in that context is they wanted to have confidence that the NHS was going to train the staff numbers it needs for the future. And that's what this plan today does. It's, to your point on delivery, this is a plan that NHS leaders themselves have written, that the government has backed with £2.4 billion of funding. And it's something the NHS has said they wanted the government to do. So we've listened, we've acted. The Prime Minister, the Chancellor have committed the money, the £2.4 billion, to back this. That gives people confidence that the NHS will have the staff it needs to get the treatments to people for the future as we celebrate its 75th birthday and the amazing things that it does for us now.
OK, focus on the future, delivering those key workers that we need and key team members. When can we, as the consumers of the NHS, which is everyone, when can we feel the difference in some of those targets that have been missed? When will waiting times come down? Have you seen how this is going to actually impact on us in the next year or two?
Yeah, it's absolutely fair, and that's why we're boosting capacity now. So if I give you one practical example, we're investing in more community diagnostic centres to get the tests and scans to people quicker and to make that more convenient for people. We've opened 108 new community diagnostic centres. We're going to open 160. We've got 43 new surgical hubs, new and expanded surgical hubs, so we can get more treatment, because as there's been more demand coming out of the pandemic, we need to boost our capacity to do so. So that investment is going in. We're putting in the extra diagnostics, we're putting in the extra treatment. And let me give you a practical example of that. In the past, in our deprived communities where smoking is highest, 4 in 5 people used to have their lung cancer diagnosed late. Through our lung cancer screening programme, through the pilots that we've had, we've turned that on its head. It's now 3/4 of people getting diagnosed early. And when I was chatting with a patient, a smoker in Nottingham who had had that lung cancer check, that had saved his lives. The survival rate, if we can detect those cancers early, is transformed compared to when they're detected late. So it's looking at how we deliver services differently through things like our screening programme, but it's also about saying for the long term, we recognise with an older population, with more complex needs, we are going to need more people working in the NHS. And the 2.4 billion today commits to that and creates a long-term framework that we can come back to.
No one would argue that we definitely need more people working in the NHS with the vacancies there are at the moment and everything else. But Steve Barkley, we're going to have to leave it there. Thank you for joining us this morning.
Good to speak to you.